Welcome, my friends, to the Bob and Brad podcast. My name is Mike Keenitz. I'm a PT assistant, and today I'm accompanied by
Bob Shub.
This guy over here. Today we're interviewing Sierra Corbin, who is a speech-language pathologist from Oregon. Is that how she said it?
Oregon, right.
We were saying it wrong. She corrected us. She also has a YouTube channel called Sierra Speech, where she offers free speech video programs. So if you want to work on your speech at all, you can go check it out there. So without further ado, here's Sierra. Okay, we're going to start talking about improving your voice after a stroke.
Okay.
So can you talk about the 3 common diagnoses after a stroke?
Sure, yeah. Well, first of all, improving your voice after a stroke, when there's been some sort of assault to your brain, that can affect your voice just like it affects the rest of your body and muscle. Because there's a lot of different parts of our brain that have to do with voicing and speech. And one thing I wanted to share was a video stroboscopy, because no matter what's happened with a change in your voice, you want to get an imaging study in order to figure out what to work on. And so while I'm pulling that up, I can say that the most common voicing deficits are a change in pitch, so your range, usually the higher pitches, and vocal quality. So you can be breathy, strained. Can you see my screen?
Yep, I can see it. Yep.
Okay.
There we go.
This is a typical voice, so not after a stroke. We're looking at the vocal cords, and this is a video stroboscopy, so we're seeing them move in slow motion.
From tiny resonating muscles called vocal cords. They're about the size of a dime in a woman and about the size of a nickel in a man. Your vocal cords vibrate very quickly, 120 to 240 times per second in conversation. The human eye can't track that.
Okay, so when they popped open, they were breathing, and when they were vibrating slowly, that was them phonating. And you can see that they're symmetrical. They've got a nice wave. The structures around the vocal cords aren't coming in and taking over. Everything looks really good. So you would use an imaging study to figure out what the deficits are for voice. So you could work on relaxation potentially. We have semi-occluded vocal tract exercises with things like straws, where you're creating literally by occluding the air, it has nowhere to go. So you create a back pressure in your throat, and that kind of releases the muscles. Working on respiration to get better support, things like that, depending on the need for the voice.
So you yourself look at that test or get the results?
So people's first step, and this is if they're even diagnosed. So if you go in for an inpatient stay with a stroke, hopefully your doctor realizes there's a change in your voice and refers an SLP to you, and hopefully they recognize that you have a voice change. If you don't have an inpatient stay, hopefully your outpatient or home health person will recognize that you have a voice change. But as you can imagine, this isn't diagnosed enough.
Sure.
Especially post-intubation, people might say, oh, you'll just have a hoarse voice for a little while. So the first stop is usually an ENT, ear, nose, and throat doctor, and they will take the same type of little camera and look at your vocal cords. The thing to think about, though, and this is in the blog post that I wrote about, is that most ENTs are generalists, and they don't do extra training for voice disorders. So if possible, try and find a laryngologist, someone who's a voice expert and has the strobe light. Most ENTs don't have a strobe light, so they're just seeing your vocal cords with the naked eye. Are they coming together? Do they have cancer?
Sure.
Things like that. So anywho, hopefully you get yourself to someone who has stroboscopy, and that could be an SLP. I do not do it myself. I contract someone to do it for me. And then if you're going to get therapy, same thing with speech pathologists. You graduate as generalists. And so ask them if they have experience with voice disorders.
Perfect.
Yeah. And as to your question about different diagnoses post-stroke, so there's voice, which we just talked about. Aphasia is a language disorder where, depending on where the lesion was or lesions, you can have a change in receptive language, which is understanding what people are saying or writing or signing, expressing language, so using words. And there's a lot of different types of aphasia. They're basically fluent or non-fluent. Do you have a lot of speech coming out or a little bit of speech coming out? And that can affect, again, reading, writing, sign language, not just your oral communication. And then dysarthria, speech disorder, where the muscles themselves aren't able to execute what you need them to do. So you can have slurred speech, inaccurate placements, things like that, weakness. And apraxia, which is a motor programming disorder where
Like coordination?
Like coordination, exactly. Yeah, the information gets jumbled. So you can physically, all your muscles are working just fine.
They're strong.
But you don't know what to do with your mouth.
Sure.
Which diagnosis can someone typically see the most progress in? Or does it vary?
It totally varies. I mean, you can be severe or mild in all of these areas.
Sure.
And you can have all of them, or two of them, or only one of them. So that's why a speech pathology assessment is really key, because we are the ones who pinpoint what the problem is. And that informs our therapy on what to do for it.
Do you want to mention your YouTube channel for us?
Yeah. So I created an online voice program for folks who just want to change the way that they sound. And it works on all of those things we talked about today, but in greater detail. And it has specific exercises, and it is backed up by the research and the evidence and, the science that supports motor change. Sorry. That supports, again, I have an 18-month-old. I don't sleep very well.
Sure.
But
understood.
So it uses dosage and specificity and all of those things, but it's really simple to understand and to do, and it's super fun. I even brought on a friend who's a professional singer to do some of the modeling, and it's on my YouTube channel.
How long is it?
I want to say the videos themselves are about 2 hours, but they're in little videos, so you can pick and choose which ones you want to do. Yeah, and it's totally free. To anybody who wants to improve their voice, there's a PayPal link if you want to support it.
And your channel is called Sierra Speech on YouTube?
Yep.
We'll link that for everyone watching this episode or listening.
Thank you.
All right. Well, is there anything else we can do for you?
I was so happy to get to do this. Thank you so much. I love your channel.
Well, we love you.
Thank you.